Is it possible to do retina surgery for diabetic patients who have tractional retinal detachment and not inject oil inside the eye? What happens if you don't inject oil inside the eye? Yes, it is definitely possible to have the procedure done without oil injection. However, it is extremely important that the surgeon make sure that there are no breaks on the retina when the surgery is done. The whole surgery is about peeling off the membranes which are causing the retinal detachment. So while peeling these membranes, if the retina does not get broken, if there's no tear on the retina, yes, it is possible to leave the retina as it is without injecting oil. But you must understand there are cases where the surgeon really cannot make out the break on the retina, sometimes because of a blood drop there, because the view has become hazy. You can't really make out whether there has been a break on the retina. So the safer option is to inject oil. Now, when oil is injected, the patient is happy because vision has come back on day one. The patient is able to see something. Whereas if you do not inject oil, most likely there will be a vitreous bleed, vitreous heme, we call it, and that blood blurs the vision. Patients really feel they have lost vision after the surgery, and they are very upset because of the bleed which has happened on the retina. So for patient satisfaction, sometimes it is important to inject oil and give them an assurance that their vision is going to come back, because now the retina is all settled with the oil injection. But if the patient is okay with having blurred vision for a month after surgery, the best thing to do is to leave it without oil injection if you are sure that there have been no breaks on the retina when the surgery is done. Once oil is injected, it is important to give a position, a post-operative position to the patient. Now, I avoid prone position for the only reason that hyphema can develop. That means blood can come into the front portion of the eye and actually cause more blurring of vision and cause even an increase in intraocular pressure. So for this reason, I prefer to give the patient a position to one side. He should either sleep on the side of the eye operated or on the other side, but not supine and not prone. When you give a one-sided position to a patient, most likely the retina settles very beautifully and there isn't any bleeding coming into the front portion of the eye. So post-operative position, again, is very important when oil is injected. When oil is not injected, definitely it is better to give a high up position. So if the head is a little in a higher position, bleeding settles downwards.